Hello, I'm Dr. David Shapiro. I'm ophthalmic surgeon. I'm working here in London International Medical Center, and I'm going to tell you about Botox. Botox is a molecule that first was used by ophthalmologists for ophthalmologists, absolutely not for cosmetic purpose, but for pathologic purpose. It was used for pathology of the eyelids called blepharospasm. Some people have got this nervous problem. It's not something you don't want to do, it's something compulsory, and you have a permanent nervous impulse that makes your eye go like this and close very, very brutally. So we invented the Botox like 40 years ago to inject directly into the eyelids so that the muscle would relax and those patients could have a normal social life because they cannot drive anymore, they cannot work anymore because their eyes are closed all the time. And when people starting to inject Botox around the eyes, they noticed that those patients had less wrinkles here. They say, oh wow, that's interesting, let's do it for a cosmetic purpose. So they started injecting Botox here and here and here, where all the big muscle movements create wrinkles. Botox is not a poison, is not something dangerous. It is injected in a very, very little quantity under the skin, in the muscle. It is a very, very effective thing. It relaxes the muscle, so it will prevent the skin to break. So the movement wrinkles will disappear and most of it won't get worse with time. Botox is something that is injected with little needles. It is quite painless. It is not something that it's a bit bothering, but it's not very painful. It may make some bruises, of course. When you inject, you can have some bruises, but they won't last. Botox will start working after 3-4 days, and then it will stay effective for 4 months. After 4 months, there is no more Botox in a human normal body. So you will have to do it again, or stop doing it, but then the muscles will come back and the wrinkles will start coming back again. Best to be injected is when you're young and you have lots of muscle movements and that you do not want the wrinkles to appear. So that's where Botox is very, very effective. When wrinkles are really here and very, very deep, unfortunately, Botox will make them less appear and it will prevent them to get really worse, but it won't make them disappear. That's not true. So, if you want any advice about Botox injections, you can take an appointment with me and I'd be very pleased to advise you on this in the LIMC.